Dr. Gupta, we know very little at this point about the president's plan, but we do know Obamacare subsidies will expire at the end of the year without action, which means costs are going to go up. Remind us how much prices could rise and the impact that would have.
Sure, Anna. Take a family of four in Kentucky. We're expecting, if that family of four makes about $85,000 a year and gets their insurance through one of these exchanges set up about 10 years ago, their premiums could increase by $23,000, so a quarter of their annual gross income. That's unsustainable. I should note, just to follow up on impact and what Jake was mentioning, it sounds like there's going to be a trade-off here, and it's important to note that if they're going to force individuals who make less money and are reliant on these exchanges to have 0% premium, so go from a silver to a bronze plan, what does that actually mean? It means that, in effect, people will have to pay more into a deductible before their insurance kicks in, these high deductible health plans that one must have if then you have a health savings account. That's part of having a health savings account, is you have to have a high deductible health plan, spend a lot of money before your health insurance actually kicks in. Here's the rub. An HSA contribution, or sending checks to Americans across the country, this is what we keep hearing from this administration. That does not make up for the lack of underinsurance or being uninsured entirely. So sending $2,000 to people across the country for a health savings account, Anna, we know from data that very few people in that $50,000 and less income range actually contribute to an HSA, even if they have excess cash, because they put that cash to work. They're not saving it for healthcare costs. So it's important to really dive into the details here.
So if the administration, based on my understanding of Jake's reporting, is asking people or trying to incentivize people to sign up for plans that are going to bring them lower health care coverage, ultimately less insurance, should something terrible happen to them. I mean, does that have ripple effects through the healthcare system in terms of being able to ensure healthcare coverage for everybody?
Absolutely. Right. This notion that $2,000 is going to, or some check to people across the country relying on these healthcare exchanges is going to do the trick, misses the point entirely, as you're really leading towards. It doesn't cover an unexpected emergency room visit that runs tens of thousands of dollars, hospitalization, even an expensive therapy or an elective procedure. These are tens of thousands of dollars in some cases. An HSA contribution won't do anything for that. People need health insurance that's affordable. So not high deductible health plans, affordable deductible health plans. That's not what they're talking about. The ripple effects will be that people will go either without care, so they'll be underinsured. They will go uninsured, not seek care till it's too late. And for the hospital standpoint, they won't get compensated care. So hospitals will struggle, providers will struggle, patients will go without necessary care. So the ripple effects will be massive.
Doctor, I also want to ask you about some recent changes in the Department of Ed, and we're learning the Trump administration is leaving nursing off a proposed list of what are considered professional degrees that has to do with qualifying for federal student loans. Nurses arguably interact the most with patients. What's your reaction to this proposed change?
It's a big deal. And so just for everybody out there, there's a program called the Grad Plus program. It's going to exist through 2026, summer of 2026. If you're applying to medical school, law school, and up till 2026, even nursing school, you are given a non-need-based loan to get through your education, because these are expensive training programs, but we need these specialties for a reason. We need nurses, we need doctors, we need lawyers for a reason. Society functions on them. In this case, the Trump administration, starting in next summer, will exclude nurses from maximum withdrawal of graduate loans to fund their education. So at most, they'll be able to get $100,000 potentially towards nursing school. Nursing schools can cost up to $150,000. And so there's a huge ripple effect here at a time when our country needs more nurses. We're expected to have a shortfall in the next 5 years of about 300,000 full-time equivalent nurses across the country. We need nurses to power hospital wards, urgent cares, primary care clinics, ICUs. This is the wrong move here at the wrong time. We need to be supporting more people to get this education, not less.